Hey there, welcome back to my channel. Today I'll be discussing one of the most important topics in the central nervous system, and that is basal ganglia. Uh, Watch this video till the end so as to get the clear concept of how the basal ganglia works, especially the connections part and the internal connection parts. Okay, and I hope this video is going to change the way you view the basal ganglia in the central nervous system physiology. And basal ganglia is of course a long essay, and it can be also asked as a clinically oriented question for you people. Okay, and for those people who haven't subscribed to my channel and you're watching the video, please hit the subscribe button. So let's see under what subheadings we can divide the basal ganglia. What are the learning objectives of the basal ganglia? Let's have a brief introduction regarding the basal ganglia. Followed by that, let's see the parts of the basal ganglia, the anatomical considerations, and then the connections, very important. And then in the connections, we will see the two important circuits. One is called as the direct circuit, and one is called as an indirect circuit. And let's see the functions, and then we will see the disorders affecting the basal ganglia. In the disorders affecting the basal ganglia, I would just like to talk about the Parkinson's disease, not much in detail, but very, very briefly. So what is basal ganglia? What do you understand by the word basal ganglia? Basal ganglia is nothing but a group of gray matter masses which are situated at the base of the forebrain. Because they are situated at the base of the forebrain, that's why this group of gray matter masses are called as the basal ganglia, or they are also referred to as the subcortical nuclei. Okay. Usually, the basal ganglia, in comparison with the cerebellum, is not having much of the connection with the spinal cord. Cerebellum had a profound connection with the spinal cord via the superior, middle, and the inferior cerebellar peduncle, and even there is no direct projection also to the brainstem areas coming from and to the basal ganglia. So what is it with which the basal ganglia is connected? The basal ganglia is basically connected from and to the cortex. That is, inputs are also majoritarily are coming from the cortex, and the outputs are also going to the cortex. Okay, so let's see the anatomical consideration. What are these group of nuclei? There are 5 group of nuclei which are present in the basal ganglia. What are they called as? One is caudate nucleus, second one is called as the putamen, third one is called as the globus pallidus, okay, fourth one is called as the subthalamic nucleus, and the fifth one is called as substantia nigra. We will have to remember all these 5. Then a combination of caudate nucleus and putamen is what is called as striatum. Okay, and then the globus pallidus is further divided into 2 parts. One is an external portion of the globus pallidus, another one is an internal portion of the globus pallidus. Similarly, now substantia nigra is also divided into 2 parts. One is called as the pars compacta, another one is called as the pars reticulata. Okay, so these are the 5 anatomical subdivisions of the basal ganglia. So this is how the basal ganglia looks like. Here you can see this is the putamen and the globus pallidus here, this area, and this area what you are seeing here, this one, okay, this is the caudate nucleus. Okay, this is called as the head of the caudate nucleus, and this is the tail of the caudate nucleus. Okay, here we can see it is present in close association with thalamus. These are the structures which are present in and around the thalamus, and also we can see the fibers here which are going to and from the spinal cord in the internal capsule. It is closely related to those fibers also. So if we see another diagram, again this is the lateral view. Here we can see this is the thalamus, okay, and this is the caudate nucleus. This entire area is what is called as the caudate nucleus, fine. And then here inside we can see these two, these are the putamen and the globus pallidus. Here this is the horizontal section. Again this is globus pallidus, okay, this portion is a globus pallidus, this portion is the putamen, this is the caudate nucleus, and we can see its close relationship with the thalamus, and also it is closely related with the internal capsule. Internal capsule is an area wherein the corticospinal tract and the corticobulbar tracts are extending, and this is the tail. And this is the frontal section wherein we can see almost all the anatomical subdivisions of the basal ganglia. See here we can see this one, this is the caudate nucleus, and then this area what we are seeing, this is the putamen, and then we see the globus pallidus. This is the external component of the globus pallidus, and this is the internal component of the globus pallidus, and this thing is the thalamus here, and below the thalamus one small body we are seeing, that is nothing but the subthalamus nucleus. And here we can see This one is the substantia nigra. Okay, so this is how anatomically the basal ganglia looks like. Next, let's enter into the connections. What are the inputs? What is happening within the basal ganglia? That is very important. And what are the outputs? Inputs, as I have told you, majority of the inputs are coming from the cerebral cortex. So the inputs which are coming from the cerebral cortex, they are reaching the striatum. That's why it is called as the corticostriate pathway. Not only from the cortex, they can also come from the thalamus, and that pathway is called as the thalamostriate pathway. And from which nucleus it is coming? It is coming from the interlaminar nucleus of the thalamus. Then we have raphe striate pathway. Raphe striate, okay, this is coming from raphe, means the dorsal raphe nucleus of the midbrain. And what fibers are these? These are serotonergic fibers which are coming from the dorsal raphe nucleus of the midbrain. And at last we are having the fibers which are coming from the locus ceruleus striate fibers, and these are the noradrenergic fibers. So these are the four important inputs. Out of this, the most important input is this. That is the one which is coming from the corticostriate pathway. Okay. Next, let's understand the connections within the basal ganglia. Listen to this part carefully. This is the most important part and the most confusing part. Different books will tell in a different manner, but I have taken my reference from Ganong and I am presenting you the same stuff here. Okay, listen to it carefully. So what is the input? Input is arising from the cerebral cortex. Okay, from the cerebral cortex, input is going to the striatum. And there are two type of fibers which are coming from the cerebral cortex to the striatum. One is the cholinergic fibers, wherein the neurotransmitter is acetylcholine. Okay. Second one is glutaminergic fibers, wherein the neurotransmitter is glutamate. Remember, both glutamate and acetylcholine, they are excitatory fibers. That means excitatory fibers from the cerebral cortex are going to the striatum. Now, from the striatum, the fibers are going to the globus pallidus internal segment. Globus pallidus internal segment, and these are GABA fibers, GABAergic fibers, and we all know that GABA is a inhibitory neurotransmitter. Okay, now from the globus pallidus internal segment, the fibers are going to the thalamus. Again, these fibers are inhibitory. These fibers are inhibitory, and the output from the basal ganglia is emerging out of this globus pallidus internal. This is the last part, and the output is going to the thalamus. Now from the thalamus, the output goes to the cerebral cortex. That's why I told you in the initial part of this class that basal ganglia is receiving the inputs basically from the cerebral cortex, and basal ganglia is also sending the outputs also to the cerebral cortex. Okay, the output is coming from globus pallidus internal segment and it is going via the thalamus to the cerebral cortex. Okay, so now what is happening? This circuit is what is called as the direct circuit. This is the circuit which is called as the direct circuit, and this direct circuit is providing excitatory output to the cerebral cortex. Now you might be wondering, why is it that I am telling that this is providing an excitatory circuit to the cerebral cortex? The reason behind that is the information coming from the striatum to the globus pallidus internal segment is inhibitory, and the information coming from the globus pallidus internal segment to the thalamus is also inhibitory because it is releasing GABA. That means striatum is going to inhibit globus pallidus internal segment. Now, what kind of an information is coming from globus pallidus internal segment to the thalamus is again an inhibitory impulse. So, what the striatum is doing is striatum is inhibiting that inhibitory impulse. So, there is an inhibition of the inhibition. When there is an inhibition of the inhibition, the output is going to be excited. I hope you understood this. And this is called as the direct circuit, and direct circuit is excitatory. Now let's understand what is the meaning of indirect circuit. Okay, so indirect circuit also from the cerebral cortex to the striatum. Okay, now from the striatum, cerebral cortex to the striatum, what fibers are there? There are excitatory fibers. Now from the striatum, it goes to the globus pallidus external segment, and these are inhibitory fibers. From the globus pallidus external segment, the fibers go to the subthalamic nucleus. Again, these are inhibitory fibers. Now, from the subthalamic nucleus, the fibers come back to the globus pallidus internal segment. And what are these fibers? These are glutaminergic fibers. Glutamate is an excitatory neurotransmitter. So now what is the influence of the subthalamic nucleus on the globus pallidus internal segment? It is excitatory. So what was the influence of globus pallidus internal segment on the thalamus? It is inhibitory. So that means subthalamic nucleus is excitating the inhibition of globus pallidus internal segment on the thalamus. That means the output which is coming from this circuit is going to be not excitatory, it is going to be inhibitory. You understood? In the direct pathway, what I told you is there is inhibition of the inhibition. Now, what is happening in the indirect pathway is there is excitation of the inhibition. When the inhibition is excited, the output which is coming out of the basal ganglia will be always inhibitory. So, this output is going to be an inhibitory output. So, here we have two pathways. One is a direct pathway, another one is an indirect pathway. The direct pathway's output is excitatory or stimulatory, and the indirect pathway's output is inhibitory. Now, the story is not going to end here, okay? Because we have very important aspects still remaining in this story. That is substantia nigra, pars reticulata, substantia nigra, pars compacta. Now, the substantia nigra pars compacta is going to project to the striatum, and these fibers are very important fibers, and these are called as nigrostriatal fibers. Okay, and what is the neurotransmitter here? The neurotransmitter here is dopamine. The neurotransmitter here is dopamine. Okay, the degeneration of these nigrostriatal fibers is going to result in a disease which is called as Parkinson's disease. Okay, it is said that these nigrostriatal fibers, which are the dopaminergic fibers, they are usually inhibitory to the striatum. So that means the striatum is receiving excitatory input from the cerebral cortex in the form of glutaminergic and the cholinergic input, and it is also receiving inhibitory input from the substantia nigra pars compacta. So there has to be a balance maintained between the excitatory input and the inhibitory input for the motor functions to go on smoothly. Not only that, there is also information coming from the striatum back to the substantia nigra, but to the pars reticulata. And these fibers are again inhibitory because the neurotransmitter is GABA. And these are called as striatonigral pathway. And remember, degeneration of this striatonigral pathway is going to result in one more disease of the basal ganglia, which is called as Huntington's disease. Okay, so if this pathway is gone, that is causing Parkinson's disease, and if this pathway is gone, that is resulting in Huntington's disease. I hope I am pretty clear with this. After this, there are few more small minute things in this circuitry or the pathway which we will have to understand. One is from the globus pallidus internal segment, the information is also going to the PPN. From there, it goes to the spinal cord. PPN is nothing but pediculopontine nucleus. Second thing is, from the thalamus, the information can again go back to the striatum. Okay, and from the substantia nigra pars reticulata, the information can also come to the thalamus, and that is again GABAergic information. So that means the direct pathway is having a stimulatory effect, the indirect pathway is having an inhibitory effect. So a balance between two pathways is very much required, and the balance has to be maintained. What about the nigrostriatal projections? The nigrostriatal projections have said they are said to have an excitatory influence on the direct pathway and an inhibitory influence on the indirect pathway. This is one thing. Second thing we should remember here is that the striatum is also getting cholinergic information from the cerebral cortex. These are the cholinergic fibers. Now, a balance between dopaminergic and cholinergic fibers also should be maintained in the striatum. If there is degeneration of the nigrostriatal tract, then what is going to happen? The dopaminergic information which is coming to the striatum will be reduced, and cholinergic information is going to increase. Now this is going to cause an imbalance, and this is going to result in Parkinson's disease. Okay, so any alteration of this balance between a stimulatory influence and the inhibitory influence is what is going to lead to motor imbalance. Now that was the connections. We have seen the inputs, we have seen the internal circuitry, and we have also seen the outputs which are going to the cerebral cortex and few of the outputs which are going to the spinal cord. Coming to the function, first and very important function is planning and programming of the movement. Now, what do you understand planning and programming of the movement? When my mind says I will have to lift up my arm, before that thing I will have to plan and program that movement. That is what is planning and programming, because if planning and programming is not done, then the movement is not going to be smooth, and sometimes the movement may not occur itself. Second point is cognitive control of motor activity. Whenever I use the word cognitive, cognitive means thought process. Okay? Before I make any kind of movement, there is a thought which is generated in my brain that yes, I have to make this movement. That is what is the meaning of cognitive control of the motor activity. If the thought is not there, then the motor activity may not happen. Third thing is subconscious control of motor activity. Sometimes when I'm talking to you people, I'm moving my hands subconsciously. There are a lot of facial expressions which you people can see. This is what is called as subconscious control of the motor activity. Control of posture. If there is lesion in any part of the basal ganglia, the posture is going to go out. The person cannot maintain the posture, and basal ganglia is also very important in maintaining the tone, and it is usually having an excitatory influence on the maintenance of the tone. Control of automatic associated movements, like whenever I am walking, I am swinging my arms. Okay, so these are some of the important functions of the basal ganglia. Coming to the Parkinson's disease, it was originally described by a person called as James Parkinson. That's why it's called as Parkinson's disease. It is also called as paralysis agitans. Why does this occur? This occurs because of the degeneration of the nigrostriatal tract. And in the Parkinson's disease, mind you, because there is an imbalance between excitatory and the inhibitory influence, we are going to see both hyperkinetic and hypokinetic features. So what are the features of Parkinson's disease? There could be rigidity, and this rigidity is what is called as cogwheel rigidity or the lead pipe rigidity. Rigidity is nothing but it's a form of hypertonia. One more form of hypertonia is what is called as spasticity, which is seen in upper motor neuron lesion. There could be tremors, and the tremors in this condition are what is called as the resting tremors, or also called as the pill rolling tremors. Whereas we also see tremors in cerebellar lesion, and those are called as intentional tremors. Third thing is there could be akinesia. Akinesia means no movement at all. Sometimes there is also a term which is used which is called as bradykinesia, and bradykinesia means reduction of the movement. Now akinesia and bradykinesia are hypokinetic features, whereas rigidity and tremor is coming into the category of hyperkinetic feature. There could be mask-like faces. Why mask-like faces? Because of bradykinesia. Person is unable to move the face. Whenever I am talking, there is a lot of facial expressions. I may smile, I may grin, I may look sad sometimes. But that kind of an expression is never seen in case of a person who is suffering from Parkinson's disease. That's why it is called as mask-like face or expressionless face. And the gait is also changed because the person is unable to maintain a posture, and the gait here is called as pestilent gait, or it is also called as the shuffling gait. And there is also loss of associated movements. 99% of us, whenever we are walking, there is a movement of our arms, that is called as arm swing. In a lesions of the basal ganglia, there is no arm swinging. The person is going to put his arms straight down and then he is going to walk. And it can also affect the speech, and the speech can become monotonous. Okay, so rigidity, there can be rigidity, there can be trembling of the head, there can be rigidity, trembling of the extremities, there is a forward tilt of the trunk. Okay, there could be reduced arm swing, no arm swinging, and there could be shuffling gait with the short step. This is what is called as pestilent gait. Okay, so I hope the learning objectives for this session were fulfilled, and I hope you have understood the concept. We started with the introduction, wherein we saw what is basal ganglia. Then we saw the parts of the basal ganglia, the 5 nuclei. Then we saw the connections, wherein we saw the inputs, and we saw the direct and the indirect pathway, and then we saw the outputs, and then we also learned regarding the functions of the basal ganglia, and at last we learned regarding one very important disorder which affects the basal ganglia, that is the Parkinson's disease. Hope I was able to make you understand the concept behind the basal ganglia, very importantly the connections of the basal ganglia. Okay, so if that was the case, then kindly hit the like button, subscribe to my channel, and share this video as much as possible among your other friends and other students. Okay, thank you. See you again next time. Take care till.